Good afternoon, my name is Joseph Phillips, and today I'll be assessing the abdomen. We'll begin with a visual inspection, and then we'll move on to auscultation, and then we will finish with palpation. So the first thing we're going to do is identify ourselves to the patient, explain the procedure, verify the patient's information, and then we'll begin our exam. For this exam, we would normally have the patient exposed down to the pubic symphysis, but for these purposes, we'll be assessing the patient with their clothing on. So the first thing we're going to do is we're going to lay the patient completely flat like we have, and then we'll be looking at the contour. This patient's abdomen is symmetrical, it's flat, there's no visible aortic pulsations or peristaltic waves. We'll note that the umbilicus is inverted and it's midline. There are no piercings, no scars, and no tattoos. Then we also note that the skin color is pink, it's warm. We'll then move on from that part to auscultation, and we'll be listening to bowel sounds in all four quadrants. And for that, we'll use our stethoscope, using the diaphragm. Okay, active bowel sounds are present in all four quadrants. The next part of the assessment will be listening to the abdominal aorta, renal, iliac, and left and right on both sides, listening for any kind of bruits. For that, we'll be using the diaphragm. We'll begin with the abdominal aorta, which is just with the diaphragm. Move on to the left and right renal. Left and right iliac. Okay. There was no feeling of pulsations and there was no bruits assessed during that auscultation. Next thing we'll be doing is we'll be assessing, percussing the abdomen in all four quadrants. Start at the left, right upper, right lower, left lower. Okay. Tympany is noted in all four quadrants of the abdomen. We're going to move on to assessing for CVA tenderness, which will be having the patient sitting up, and we'll be gently percussing on the back at the 12th rib on the left and right side. Go ahead and sit up for me. Okay, no tenderness is noted for CVA. Then we're going to be moving on to a deep palpation of the abdominal aorta. It'll be just below the xiphoid process. We're going to take and just apply some gentle deep pressure. No masses or pulsatile masses are noted. And it appears to be a non-tender assessment. The next thing we're going to be doing is you're going to be moving on to the all four quadrants. We'll be doing some palpation of all four quadrants, feeling for any masses or any tenderness. Starting with the right upper, left upper, right lower, left lower. Okay, there are no masses or tenderness assessed there. And now we're going to move on to the liver borders. We're going to start on the right upper quadrant. We're going to move our way to the left. Okay, the liver is unremarkable and non-tender. Then we're going to move on to the right lower quadrant and assess for rebound tenderness. Okay, to assess if the patient may have an appendicitis. So right lower quadrant, we'll push deep, and then we'll let go. We'll repeat it. We'll let go, and there's no sign of tenderness there, so which would indicate if there was tenderness, it would be a clinical indication of a potential appendicitis. So this will conclude my abdominal assessment.